Hi Andy, how are you?
I'm good. How are you?
Are you ready to hear the information about the patient?
Yeah, let me know.
Okay, patient is a 28-year-old Caucasian male admitted to the emergency room for schizophrenia. Patient became violent with his mother and threw a table at her when she asked him to take his medications. The police brought the patient to the hospital on a 5150 hold. Patient has a 10-year history with schizophrenia and has previously taken his medications consistently. Recently, the patient has become withdrawn and socially isolated. He has stated that he believes that his food is being poisoned and his mother suspects that he has stopped taking his medication. He believes his medication is a result of his recent weight gain, and the current medications which he has been taking for the past year include olanzapine 10 milligrams and venlafaxine extended release 75 milligrams daily. Patient believes people are listening to his thoughts, and he has auditory hallucinations telling him not to eat the hospital food. His vital signs are stable. His temperature is 37.2, heart rate is 90 beats per minute, respiratory rate 16 breaths a minute, blood pressure 134/84, and blood oxygen is 96%. He appears tired. His speech is tangential with some evidence of neologisms, and it is difficult to carry on a conversation with him. He has refused a shower and has a disheveled, dirty appearance. The recommendation is to orient the patient to reality, offer food, and find ways to encourage him to eat it. We need to discuss medications and try to get the patient to take his medications. What interventions do you have, Andy?
Okay, Hannah, so I just received a report from Kimberly, and I think we should implement these following interventions. So the patient is pretty disheveled and he's refusing his showers. So I think that we should establish a daily routine for hygiene and dressing. And we should be pretty calm but firm in what we tell him, and set those expectations and boundaries and make them clear to him.
Yeah, that's a good idea.
I think so too. And if the patient is actively having hallucinations, it's important not to argue with him or confront him, but we should attempt to acknowledge that that's what he's experiencing and to explore how he feels about them using therapeutic communication. And during the hallucinations, it might be helpful to use distraction therapy. Like if it's hallucinations or auditory, we can have him listen to music or something.
Yeah, that's a good idea. Yeah, that always helps. Not always, but many times helps.
Yeah, I agree. And it sounds like the patient is having some paranoid delusions right now, so we should probably, whenever we approach him, we should come in from the side, and we should ensure to keep a nice spatial boundary between ourselves and the patient to make sure he feels safe and that it's a non-threatening manner. And the last thing I think we should do is we should orient the patient to reality whenever we can, be reassuring, and to try to give him some education on the medications.
Yeah, we definitely want to proceed with the medications because he hasn't been on it for a while, and according to his mother, and plus, he has all those delusions and hallucinations that are.
And thank you for bringing that up. That brings me to my last point. If he is agitated or if he's having delusions where he might present a safety risk, then we should try to remove the dangerous objects in the environment and to try to decrease any stimuli. And maybe we can try to redirect him away from other patients if they're in the area.
Oh yeah, definitely. Okay, I guess go to work.
All right.
Okay.
Oh, you're back, Hannah. How did it go?
Oh, well, you know what? Actually, those interventions that we applied and Andy mentions, they were pretty effective, I have to say. We made sure that all the environment was safe, and he did not have any command hallucinations, which was good. But still, we want to make sure he was safe. So basically, we talked in a calm voice, and we explained all the information about his medication and his need for the treatment. And he actually, we used therapeutic communication, so he was able to understand everything, and he remained calm during all those encounters with us, and he understood what was expected from him too. So each time he mentioned something about voices, we noticed that he was kind of getting irritated. So we used music to kind of calm him down, and because he likes he likes music, he had his own choices. So that seemed like it helped, and I think overall it helped with all the rest of intervention, which were really important, like giving him medication, because after a few attempts, and he finally took his meds. And after that, he actually, because he mentioned he would eat maybe something if the food was prepackaged, so we got like the tightly wrapped up sandwich, and he was able to eat like 50% of it, so that was a success. And we offered him a protein bar, and he also was like, maybe not at this moment, but he considered to take it. And he was suspicious about the meds at first, but then later on he followed, and after that, which was a real success, we got him into group therapy, and he actually stayed for the whole group therapy. So all those interventions turned out really great effects.
Wonderful.
Yeah,
I'm so
very
glad to hear.
effective. Yeah.
Great,
Alright.
effective interventions, and hopefully he continues on the right path.
Absolutely. I hope so too. All right.
All right.